right, more and more women turn to alcohol to relieve stress from work or home. But a new study finds women may be better off putting down that glass of wine. Dr. Malika Marshall joins us now. Doctor, I feel like for a while now we've been warned about the effects of alcohol, especially on women.
That's right. There's mounting evidence that it can increase the risk of certain health conditions, like breast cancer, for example, in women. And now researchers at the University of Hong Kong, they looked at data on more than 40,000 men and women in Hong Kong and in the United States. And they found that people who never drink actually reported having the best sort of mental health outlook. Oh. But they also found that women at the beginning of the study who were sort of moderate drinkers, if they quit, that they got a boost in their mental health happiness within 4 years, almost to the point as if they had never been drinkers at all.
Wow.
So when you're thinking, oh my gosh, I'm so stressed, I really need that glass or 2 or 3 of wine at night, it probably is better to put it down, and you might actually feel better in the long run.
By the way, welcome back from vacation. I'm sure you had no wine on vacation.
None. I did have some vodka, though.
All right. Young people are often warned that too much social media use could lead to mental health problems like depression. However, a new study finds that networking sites may do the opposite for adults. Why the difference, doctor, between how young people use social media and its effects and more mature individuals?
So this was actually a professor at Michigan State University. He says, look, you know, the prior studies have generally been done on young people, on teenagers and college students who sort of have psychological distress at baseline anyway, just because of their age. So in this study, he analyzed data on thousands of adults, generally over the age of 30, between 2015 and 2016. And he found that the social media users were 63% less likely to experience serious psychological distress. So major depression, serious anxiety, compared to people who did not use these networking sites. And he thinks that it might make it easier for adults to sort of communicate with one another and stay in touch with extensive family and with friends, and also have better access to health information.
It's interesting because I feel like we often do studies about how there's a feeling of dread when you're on social media and it feels like someone's living a better life than you are. But it turns out maybe it's actually making us feel like we're part of a community.
Exactly. Those of us who are a little bit more mature, our brains are more fully formed.
Those of us like you, not necessarily
You too. You're over 30.
Lisa, over to you.